hassle of um, of the health industry. So diseases like diphtheria, dysentery, cholera, plague, and simple cellulitis and staphylococcal infections, tuberculosis, then parasitic infections like malaria, dengue. Malaria and dengue were almost considered equivalent to cancer as of today. So anybody who used to get malaria, people used to people used to cry. The whole family used to get together, and they knew that the person is not going to live. So that era of infectious diseases is now on the verge of it has passed on, and today's era diseases is of autoimmune diseases. So the diseases that are prevalent today are autoimmune diseases or pathologies which are not considered curable. And why are they not considered curable? Because first of all, there is no pathogen present. So the era of infectious diseases it was tackled, and the medical science was able to tackle it because of the discovery of the microorganisms, and because of that, antibiotics, penicillin, and so on were developed. Even anti-parasitic medications were developed. So the causative organism was known, and that is why once the cause is known, then based on that theory, some treatment, some form of cure can be discerned and it can be applied. But today, the problem is with autoimmune diseases that the cause is not known to the modern science. And that is why the whole treatment, the whole tool belt of a doctor is only of palliative medicines and of suppressive medication. So either it is palliation or suppression, or it is surgical excision of the disease, of the disease pathology, or of the whole organ. So the question arises, even after so many medical advancements, why only palliation has been achieved by the modern medical science? The reason, as I understood uh, before thinking of my topic for my MD, for my research, so these are the kind of thoughts that went on in my mind back in the day. So that is what I'm sharing with you. That I thought that no attempt has been made to understand why these diseases occur. Where is the root cause? So as I mentioned that I looked at our history. You learn from your history. So when I looked at the infectious diseases, I understood that because the cause was known, the organism was known, that is why the cure was found. But in autoimmune diseases, nobody has attempted to find the cure. In taking a shortcut, we have only resorted to palliative medicine, and we have convinced ourselves that this is the only treatment available. This is the best treatment possible. We have not gone beyond that. And that is why I think that so many autoimmune diseases which are visible in front of you, those are not tackled properly. So even despite vast biomedical advancements in the past century, uh, like the medical advancements have provided great understanding of the pathophysiological processes of the human body. But and thus modern science has certainly been able to answer how these diseases develop, the mechanism of the development of these diseases, but they have not been able to answer why these diseases develop. So because the root cause is not the target of today's treatment, that results in the diseases remaining uncured, they are only palliated, and recurrence is inevitable and unavoidable. So just like a lizard with a superficial approach, if we chop off only the lizard's tail, it will eventually grow back. We're not targeting the root cause. So as all the homeopathic doctors know about aphorism 2, that is the highest ideal of cure, the permanent restoration of health, the permanent cure. How can we achieve that? Because that is what we have been trained to do since day one. Since our first class, I remember my first class, my first organon session, we were taught about aphorism 1 and aphorism 2, the highest ideal of cure. So this teaching, we have been equipped in our blood, that we need to, from the day one, we need to think about the permanent cure of the disease. And that is what we should strive to do. So then the present golden question that arises is, where is the root cause of the disease? Because once we know that root cause, then we can permanently annihilate the disease, as it is said in the aphorism 2. So looking for the cause of the disease at the physical level will only reveal the intermediate causes of the result of the disease process. There is a whole chain of disease process that goes on. So if we look for the cause in the body, in the organ, we only find the results of the events that have taken place. We're not able to reach the root cause, the initiating factor that caused the disease. So the answer again to the previous golden question is itself hidden in a simple question, that who governs the whole body? Because all these organs are affected. So who governs the whole body? Which is the central body? And the answer is very obvious. It is the brain. So let us, with this illustration, understand how disease enters the body through the mind. So I would just like to share a thought that we were always taught, and we have read in Kent and in our philosophy, that Dr. Kent, Dr. Henneman have said that disease enters through the mind. So at the time, it used to seem like a very supernatural concept, very mystical concept, that how can disease enter through the mind, through the brain? But after giving a lot of thought, after going through a lot of literature, after going back to my basic anatomy and physiology, after doing a very in-depth study, I came up with this. And this is not all that I have come up with. Of course, I give credit to all my medical ancestors of the health industry and all the scientists. So the brain governs the whole body. That is the master organ. That is the highest structure. Now, who governs the brain? That is the mind. Now, the brain is governed by emotions. Sorry, the mind. The mind is constantly under the influence of emotions and of our conscience, of our cognition. So, since the day we are born, in fact, even before the day we are born, when a child is in embryological stage as a fetus, even then the child responds to music, to stimulus, and they respond to specific stimuli. There have been so many researches. So as soon as a little bit of cognition appears, it develops. Even in the fetal stage, the mind is active. So the mind is constantly driven by emotions and cognition, and it is always under the influence of all these factors that are listed over here. I will not read them out aloud because it is present in the slide, but you can see that dreams, delusions, our emotions, and anger and fear, all of these affect our brain positively or negatively. Now, when our mind is affected, that affects the brain. How? The mind, basically all our emotions, everything that goes on, it is part of the limbic system. It is the chemical reactions in the limbic system. So many of you may be aware of the movie Munna Bhai MBBS and the famous terminology chemical locha in the words of Munna Bhai. So that chemical locha is not just a dialogue from a film. That is true. That is our limbic system, where all the chemical locha goes on. So those neurochemicals and neurotransmitters, they affect the limbic system. Then they affect the hypothalamus. The hypothalamus, in return, it changes the reaction to pituitary gland, and through the pituitary gland, through the brain, then we enter the neurological pathway through which the brain governs and interacts and communicates with whole of the body. So there are two mechanisms how the brain interacts with the body, that is through the neurological pathway and through the endocrinological pathway. Excuse me. So as you can see over here, on the left side, through the sympathetic nervous system, how the brain interacts neurologically to the body, and on the right side through the hormonal pathway, through hypothalamus and relaying through the pituitary gland, it interacts with whole of the body and so many organs in the body. So then the question arises, where are the causes? That, I suppose, that answers the question that causes are in the mind. I won't say that that answers the questions, but that is a food for thought that I had, that causes must be in the mind, because that was the last stop, the dead end where I could think of in this chain reaction. Excuse me. So when causes are in the mind, what kind of causes are there? That is grief, humiliation, shock. Even dreams have a huge impact on the body, and I cannot stress this enough. And I always give a little time to this aspect, because this is one of the most important aspects for any homeopathic doctor. Dreams are very easily like these are misunderstood and these are ignored, because we think that dream is a dream. It is not real, it is not conscious. But the actual excuse me. So our mind, when we are sleeping, our mind does not know whether a dream is real or not. When we are dreaming, it is all very real that happens. So just try imagining, suppose a person is dreaming every single day, every single night, that he is being murdered. Just imagine how many times are you going to really encounter that kind of a situation where you are being murdered in your whole life? Maybe never. Even just imagine, even if you witness an encounter, what kind of psychological impact it has on your mind if you see someone getting murdered right in front of your eyes, and you're never going to forget that in whole of your life. Now imagine the person who is seeing that dream of himself or herself getting murdered. That person is experiencing that enormous amount of stress every single day. That person is experiencing what you might call a one-time experience, bad experience of life. That person is experiencing it every night, every single day. And the body's reaction, the secretion of adrenaline, and the activation of the sympathetic nervous system, and then like with relay effects, the effects on the respiratory system, the cardiovascular system, the your natriuretic peptide hormone gets disturbed, the cardiovascular nerves get activated, and you experience tachycardia. Then the sympathetic nervous system has responses on the eccrine and apocrine gland also. I mean, this is a huge topic. Sympathetic nervous system in itself is a grand topic, but just imagine the whole sympathetic nervous system gets activated, and all that goes on in your body every single day because of the dream that you are experiencing. This is the highest and most important symptom for any homeopathic physician. Do look out for those. We are going to discuss it later on, but I just wanted to give it enough stress over here. So dreams of dead relatives. I'm sorry, the words are not visible over here. It is dreams of dead relatives, people who are no more present with us. Phobias, fear of water is very important and very common. Fear of dog, highly important, very common. Even delusions are so very important. Delusion of being poisoned, delusion of being followed. And I don't know whether anybody of you you look out for these symptoms. Try just asking, like, just for the next 20 patients, make it a point that you look out, you ask the patient for this delusion, whether you feel that someone is following you or whether someone is standing behind you, and you'll be surprised to see how common this symptom is. And there are medicines in our repertory based on this. So the modern science has explained this concept by the name of psychoneuroendocrinoimmunology. I would give due credit to Dr. Henneman, who 250 years back, he had this theory that disease enters through the mind. As I said, that seems like such a mystical concept. That is why I paused over this discussion in the beginning, and I wanted to resume it over here, because now you will be able to understand that why it is, why we think that that concept is supernatural and very mystical. But that is so very true. The modern science has just started to recognize this pathway of disease, and it has given this terminology, that is psycho psychoneuroendocrino immunology. So there are three aspects to it. That is psycho neuroendocrinology, as I showed earlier, that through the mind and through the brain, and then relaying through the endocrinal system, the brain interacts with the body. So this is the path, one pathway of the disease. Another pathway is psycho neuroimmunology, through which the immune system, look at the keyword, the immune system gets affected. Okay. And if you just want to know a little deeper how, I'll give just a single description, that pituitary gland secrete ACTH hormone, the adrenocorticotropic hormone, which affects the adrenal gland, which is responsible for secreting all the mineralocorticoids and all different kind of hormones which are present in the body, which control the immune system. Eventually, the cortisol hormone is secreted as a result in response to stimulation by this. So this is another pathway. And then there is a combination of both, that is psycho neuroendocrino immunology. So this is the research that I conducted. I will not go very deep into this. I want to skip this quickly, but I'll just give you a slight preview. The research that I conducted based on this concept, based on this theory, the aims were to prove that psychological disturbances play a major role and a root cause in the development of physical diseases. So this, if you relate with my title, this is the role of mind in the genesis of physical disease. And then the second aspect is rectification of these psychological disturbances through homeopathic medicines when selected on holistic basis, that is classical homeopathy in very layman terms, that is considering the mental and physical generals, personality and constitution of the patient can lead to annihilation of the physical disease. So that is the second portion of my title, that is role of mind in the treatment of physical diseases. These were the objectives. It is just present in the slide for anyone to follow if they want to look at it in detail. The materials. Okay, so these are just a few terminologies which I introduced in my thesis. So I'm just showing it over here so that you can relate to this. A mental symptom was labeled as a probable causative factor based on this. That means I identified a number of like, as with homeopathic case taking, we encounter so many symptoms. So I labeled a few mental symptoms as probable causative factors of the disease based on this criteria. So I worked on these diseases, these 10 diseases, that is uterine fibroid, ovarian cyst, PCOS, fibroadenoma of breast, BPH, thyroid disorders, rheumatoid arthritis, vitiligo, psoriasis, lichen planus. You'll note that all of these are pathological diseases, not functional diseases, not something like pain in abdomen and migraine or neuralgia. These are all true diseases which can be discerned and which can be found in any investigations. They are well diagnosable diseases. Exclusion criteria was any patient who has been suffering from a physical disease, only from a physical disease or psychological stress were excluded. So this was about the selection of medicine, how it was selected. The assessment was done. For assessment, the challenge was how to make the assessment objective. So I developed two types of scores, a mental symptom score and a physical symptom score, where 0 was the least troublesome and 5 was at its worst condition. So this is just a preview, an example of a mental state score. So you can see each of the symptom has been given an initial mental state score and a final mental state score. So with this scaling system, scoring system, we can objectify the results. This is with regards to the physical state score. So for symptoms, it was up to the physician to give the score. And when there was a pathology present, depending on the grade of pathology, the score was assigned. This is the true data of the 33 patients that were included in the study. So this just chart is present here so that it can be present in the recording for people to refer later on if they want to. So one thing that I would like to point out, you can see the initial mental state score, this 4.2. After treatment, it came down to 1.3, and the difference was 2.8. Similarly, in the green, you can see the initial physical state score was 3.5, and later on it was zero point 0.9, the difference being 2.6, almost same. So what this shows is after treatment, the mental state score also improved along with the physical state score, which includes the symptoms and also the pathology. These were the 10 diseases that were covered, and this is the number of patients covered in each disease. This is the graphical representation of the same data. The pink shows initial and green shows final scores. So here you can see that over here, this is the score 0 to 1, 1 to 2, 2 to 3, 3 to 4, 4 to 5. So initially you can see how many number of patients were present in each category, and this is after treatment in the final results. Same goes for physical state score. The light blue is initial and dark blue is final scores. And you can see that over here, there was these many number of patients. Over here in the final score, there are no patients in the higher category. In the lower category, initially there were no patients. Later on, so many patients entered this category. So this is the overall state, because the important of this graph is anybody can say that maybe there was improvement only in the mental score, or maybe it was only in the physical score. So this shows the overall state of the patients. So this upper graph shows the initial state, including the mental and physical states. And this graph below, it shows the the final mental and physical state scores. This is the same representation. So just to give you a brief description of this graph, that the more anything is towards this axis, towards 0, that means it is at the best state. And the more it goes along this axis towards this point, towards the upper right corner, it is at its worst state. So you can see with the aggregation, initially the aggregate was in the upper right quadrant, that is at its worst state. And in the final graph, the aggregate is in the lower left corner towards 0. This is the graph of the difference of the scores. That is what was the impact of the treatment, the difference between the mental state score, between the physical state score, and this gives an overall review. So the importance of this graph is that you one could argue that maybe only the physical state scores improved and physical state scores were not that prominent, or maybe there was a pattern that only the physical scores were improving more and the physical states were not improving that much. But that is not the case here. You can see the random pattern present over here, and this randomness of this graph is what authenticates the findings of the study. This was the final result. So out of all the patients, 61% patients improved and 13 were cured. There were no patients who were not responding or worsened patients. Now we come to the model cases, which is what people wait for, and this is the interesting part. So coming to the model case 1, a female aged 21 years appeared with the following complaints. She had some menstrual irregularities, she had acne on the face, and she reported some serious discharge from the nipples, which only occurred during menses. This was the mental history that I was able to obtain from her. She was a young girl from a rural area who had just passed her intermediate examinations, and she wanted to pursue higher studies. But due to being from a rural area and due to being a girl, there were a lot of restrictions imposed on her with regards to future studies. Her family wanted that she should get married as quickly as possible, and therefore she always used to be sad. She had a lot of pessimism. She was very anxious. She even said that I feel forsaken and as if I am a liability on my family just because I'm a girl. She said if I had some other problem because of which I imposed a liability on my parents, I would not mind. But just because being a girl, because of the gender bias, this is happening. This is what hurts me the most. So the case was repertorized. Here is the complete repertory chart. This was the basis of prescription. From the earlier repertory chart, these symptoms were selected for prescribing for the final prescription. So the first prescription was natramio 30 weekly. This was the initial report. So you can see over here, right ovary was bulky with multiple follicles measuring around 5 to 8 mm. So I'm sorry, I did not mention this is a case of PCOD along with a left ovarian cyst, bilateral PCOD. So this is the left ovary. There are multiple follicles along with an ovarian cyst measuring 31 mm, which is visible and highlighted in the image below. So the inference is simple based on the report. And this is the final report after treatment. Both ovaries are normal. So any of you who are wondering what was the follow-up and how it was carried forward, this is a very brief description of the model case. Don't worry, I have that also in a few other cases. Because of time constraint, I could not discuss each case in a lot of detail. So I have covered different aspects in different cases. So in this case, I wanted to bring your focus to the cause, which I based on the life space of the patient, which we just discussed earlier, and also on how the case was analyzed in my thesis, in my research. So here is the live data of the patient, how the physical symptoms were evaluated. So you can see these physical symptoms are present, which have been graded. You can see the initial and the final scores. And this is about the pathology. Again, this is part of the physical symptoms, but this is the actual pathology which was found in the ultrasonography. So you can see date-wise in left ovary and in right the left ovary and the right ovary. Okay, so I just wanted to check this out. Okay, this is about the ovarian sizes, the right ovary and the left ovarian sizes. Now, this is about the follicles and the cysts, the pathologies that were present. This is for left ovary. Earlier one was for the right ovary. And she also had a left renal calculus along with PID. So the left renal calculus was cured. The only thing which which went towards worse was that earlier she did not have PID. In the later ultrasound, mild free fluid was found in the cul-de-sac. Coming to model case 2. This is a very interesting case of alopecia totalis. So before we get on with this case, I would like to mention why I have included this case. This case shows your initial failure because this is about medical practice. You're never going, you're hardly ever going to get the exact accurate medicine in the very first go. You're bound to make mistakes. You're bound to give importance to a different symptom where it is not so much required, and some important symptoms often gets ignored. So you learn from your mistakes, and like how you encounter hurdles when treating a case and then how you tackle them, how you learn from the ongoing process of treatment. This is the important aspect of this case, which I wanted to discuss over here. So, a male patient aged 14 years presented with generalized total hair loss, as happens in alopecia totalis, except just his eyebrows, partial eyebrows, and few hair on scalp. This is the initial condition of the patient, as you can see. This was the repertorial chart, the complete repertorial chart. So this will appear once again later on. So we'll discuss in detail later. But this was the case taking. This is the actual case sheet where the symptoms of the patient were noted down, on 8 January 2018. So this is just a preview of the original case sheet. So these symptoms, out of the earlier repertorial chart, these symptoms were selected. Those have been highlighted. It will be shown again later on in the repertorial chart. Based on these symptoms, natrum Myo 30 was selected. So you would expect a marvelous response, some great deal of improvement, as is common with most of the presentations, that you see an initial image and the next image shows you what a marvelous improvement has occurred. Well, here it is me showing you the failure that occurred. All you can see, the eyebrows have vanished, and the limited amount of hair, the only the two islands, two patches of hair which were present on this patient's body and on his head, have also vanished. So why did this happen? I have not given the detailed life space of the patient, because instead of reading it, I thought that I would let you know about the patient. This patient is a very anxious, very nervous type of personality. He has a great lot of stage fear. He is afraid of being beaten up. He is afraid of his parents getting angry or being scolded by them. So what he mentioned earlier was that, okay, I'll just go back and I'll show you in his life space. Over here, in this case sheet, you can see uh, over here, if you focus on this part, it is written that he was beaten by his father. So he became very frightened prior to onset of disease. And why he was beaten up? Because he did not perform very well in his examinations. Don't be mistaken, he was a topper. He was a highest ranker in his classroom. But only once he did not achieve the rank that usually which he used to achieve. And because of that, his father beat him up and he got very scared. And this happened in 2014 and 15. And later on in 2008, like right after that, he developed this disease, alopecia. So coming back to this repertorial chart. So what went wrong over here was that we gave more importance to the emotional aspect of him being beaten up. We gave more importance that he was sad. As you can see over here, this is also a very important symptom which was present. That is his sadness. So his overall body language, his gestures, his language, his tone, the words, the choice of words which he used, that gave us an impression that he was very sad and disappointed that his father beat him up. But uh, now at this point, when he was not responding, then we reviewed the case. Upon review, then we understood that it is not about sadness. It is more about the fright that he encountered on being beaten up. Also, these two symptoms were of very high importance. That is anticipation before examination. So already he used to be nervous before examination, and after this episode of him being beaten up, now even on every single test, he used to get highly anxious. He used to lose his appetite, severe anorexia nervosa, and a lot of anxiety and those kind of things. And also along with this, as I showed in the theoretical part in the beginning of my presentation, look at this delusion that someone is behind him. This, these both are covered only by Cilicia, and these are not present in Natrum Mure. So the beauty of this understanding is what I want. Basically, what I want to exaggerate on is just see that it is the same repertorial chart, it is the same number of symptoms, and it is only the analysis, the evaluation, what we learned in our final BHMS when we study the repertorial subject, that analysis and evaluation of symptoms along with elimination of symptoms. So you can see the analysis, the evaluation, that is the order of the importance of symptoms, and then the elimination is so very important. Because what happens in practice is when you have so many number of symptoms right in front of you, 20 symptoms, over here you can see 19 symptoms, you think that everything is important, all the information is so very important which the patient has mentioned, and after so much of hard work, of great labor, we come up with this repertory chart. So this must be the best medicine on the top. If that was the case, then why would the process of repertory and all these softwares present you with all these other medicines that is present over here? Then they would only give you the top medicine, or maybe only the top two medicines. So what this shows is, see, we did not get any new symptom. It is just a fresh understanding, a fresh overview of the same case taking that we did. And based on these unique symptoms and highest grade of these symptoms in the patient, we selected Cilicia. So the ailment factor was equally important, but that was also covered in Natrum Mure. So what made Cilicia stand out were these two symptoms. Okay, so then we went ahead with it. So only based on these three symptoms, when we prescribed Cilicia, look at the difference. I would not say that this is an immediate response. You can see a timeline later on. I have shown that timeline of the photographs. But just look at the response that was achieved. This is on 13 July 2020. This is on 23rd November 2020. So this is the timeline. It starts from here, goes down, and then we come over here. This is the original case sheet. So this is just for your preview of the original case taking that has been all the follow-ups that have been conducted with regards to this patient. Coming to model case 3, this is going to be a brief one. So a 43-year-old uniparous female presented with prolonged profuse menses, which lasted for 1 month. This is the repertorial chart. This was the basis of prescription: fear of being alone, and she had dictatorial nature. One thing that she mentioned, that she was not severely claustrophobic, but yes, that was a concern for her. And she had immense desire for fish. So as you can see, not everywhere we are able to find a causative factor, a causative mechanism. Often, basically, I would not say that you do not find a causative factor. Often what happens in practice is that when we look at stress, we only give importance to the profound stress, the factors which are very important, or which are very which have deep impact. Like I'll share this with you, an example. Cases where you experience someone's death, or huge losses, or legal disputes, or any major betrayal, disappointment in love. These are the great events of life which you can never forget. These are milestone bad events of your life. So these you can never forget. So when we ask anyone that are you undergoing any stress, what they focus on is these kind of symptoms. What they don't focus on is the other kind of daily life stresses that exist in your life. Like if a person is claustrophobic, but they have to commute every day in metro or bus. Imagine every day, every single day, they have that stress when they are in the transport, and they start experiencing that anxiety even before they leave their home. Every morning they wake up and they have that fear and anxiety that I have to commute through that. And even in office, an hour before they are about to start their journey back home, they start to get stressed. So often these are the important causative factors which are often overlooked and they are missed in daily practice, because a lot of times even the patient does not mention these symptoms. When you ask a person, are you feeling stressed, they say no. Then when you ask them that, do you feel happy all the day? Do you feel delighted? Do you feel cheerful? Again, they say no. Then when you start probing them that why, what is the cause of your anger? Do you get irritated? So everybody says yes, I get irritated very easily. I'm very short tempered. When you start probing them why, then they start to reveal everything step by step. A person who's very fastidious, imagine a lady who's very fastidious and her husband not so much. So that lady, when you start probing, then she starts pointing finger at her husband that I'm a very perfectionist person. I want everything to be in its place. I want to keep things organized. But my husband, he leaves things around. I have to mop everything up. I have to clean everything up. I have to keep things back to the place. And this is a major concern for me. I'm very irritated because of this attitude of my husband. So the body doesn't know whether you have encountered whether you have experienced someone's death, or whether you are experiencing a routine, usual irritability and anger. What the body knows is that you are under stress. The body's sympathetic nervous system gets activated, and because of that sympathetic nervous system, once it gets activated, there is secretion of adrenaline, which is of prime importance, and there are so many factors which go on in the body. Getting on with the case, Lyco 30 was prescribed. So the why I've included this case is the importance of this aspect. Says that, see, earlier in the two cases there was a major causative factor, a major cause of grief. Over here it was just a routine life, and often you have to resort to only the holistic approach, the constitution of the patient, the personality of the patient. You have to resort to that and then prescribe the medicine. That is if you're not able to find any major causative factor. This is the initial report. This is a case of uterine fibroid. So she had multiple fibroids. Look at the size, 6 centimeter, 59.5 mm. That is 6 centimeter fibroid. Another fibroid is of 33.5 millimeter. That is almost 3.5 centimeters. So both the fibroids, one is of around more than 2 inches, and other one is more than 1 inch. Excuse me. This is the film, and this is the final report after treatment. So as you can see, other visualized organs are normal, uterus anteverted, anteflexed, normal in size. Also, you will appreciate, I'll just go back to the previous slide once again. I think so. Okay, no, I was mistaken. Okay. Yeah, this is the follow-up ultrasonographic film. Coming to model case 4. So why I have included this case is to discuss the case in detail, that is the prescription aspect, the whole chronology of follow-ups in detail, that I'm going to discuss in this case. This is a this lady had a number of pathologies. So I'm not mentioning the exact pathology over here. We'll get to that once we get to when we reach the investigation report. So 33 years old biparous female approached for treatment of bilateral ovarian endometriotic cyst with adenomyosis. Initially, she consulted a gynecologist for recent onset menorrhagia since March 2018, and the gynecologist prescribed cycles of HRT, that is hormone replacement therapy. Later, she was advised few investigations, and because of the poor response to hormone replacement therapy, TVS was done, and TVS revealed that she had bilateral ovarian endometriotic cysts and adenomyosis and mild PID, for which she was advised either subtotal or total hysterectomy. She had no history of hypertension or diabetes, and her menstrual history is given below, which is not of very great importance. This is the initial report. So there are a lot of pathologies in this. I'm not going to read it aloud, all of it, but look that the uterus is also affected. There is minimal amount of hemorrhagic fluid in the uterus. There is a right ovarian cyst measuring 9 centimeters. That is this big, the size of an orange. Excuse me. Huge, a huge cyst. There is another cyst over here. This is 1.9 centimeter, 2 centimeters. And in the left ovary, she has 4 cysts. The largest one is 1.6 centimeter. So just look at the number of pathologies over here, and the size 191 cc. The size of the largest cyst in right ovary is 191 cc. So I'll just make a note over here so that we can follow it up later on. This is the ultrasonographic image. You can see the cyst right over here, or in this image, this is not that clearly visible. It is right over here. About the patient, the theme of the patient is, the overall theme of this person is highly anxious by nature. It is all about her. If you want to describe this person in one single sentence, she gets so the associated aspects, the other symptoms based on these themes, based on this theme are given below. Panic attacks over trivial matters, anticipatory anxiety, significant stress since last 1 year regarding some property dispute. But then again, this was more about anxiety as to what will happen in the case, and chain of obsessive pessimistic thoughts. So sort of a symptom or a situation of anxiety neurosis. This is her repertorial chart. So you see the symptoms: ailment from anticipation. She is not fond of company. She desires solitude, sadness, contradicted. She has a tendency to contradict. Why is that? Because she is highly anxious, and also she is sort of fastidious. She has a habit of micromanaging everything and everyone around her. And why is that? Because she is highly anxious. She is always concerned and suspicious that people won't do things in the proper fashion, in a proper manner. So she is always trying to micromanage people. So because of that, first of all, there is a great amount of stress because you're always thinking that things are not going to be right. Another form of stress is that because you're micromanaging your family, your children and everyone, then you start to lose that bond with your family. People start to get annoyed with you very easily, and you get a feeling that those people, like you have that emotional aspect also, that people are getting disconnected with you, and also you get that feeling that they're not respecting you. There are so many sort of emotions that go on. Another symptom which covers this thing is this: censorious or critical, suspicious, as I said, Now she has a dream of seeing unsuccessful efforts to do various things. That was also considered, but then this was not very often, not very common. It was a rare symptom, so it was disregarded in the final prescription. Excuse me. This is the basis of prescription. You need not read it right now. This is just to present it in the recording, because in the next slide I'm going to cover all these points one by one. So the first thing is that after the previous repertorization table that you just saw, the rubrics were then graded and listed in decreasing order of importance based on their evaluation or intensity, which is basically the part of analysis and evaluation, which we learned in repertory. So from these, the most important symptoms were analyzed for selection of simillimum as shown in the table. So a few symptoms were eliminated. These symptoms were have been brought forward again for further evaluation and for final elimination of a few symptoms and medicines to make the final prescription. So arsenic, calcarea carb, sepia, and sulfur are the top medicines in the repertory chart, as you can see. So we come to the first symptom. The first symptom of causation is covered by all medicines, but with the highest marks by arsenic and calcarea carb, which favors both these medicines. So based on the first symptom, we we give a little importance to arsenic and calcarea carb. Then coming to the next three symptoms, which are related to anxiety, and they are of great significance. Why I'm saying great significance? Based on the intensity which I observed during our case taking. So they are of great significance next to the causation, which was the first symptom. So these are also covered by arsenic, but not so much by calcarea carb. So calcarea carb, it went down in the importance, and obviously arsenic took a major lead. So now when we come to the thermals, the next symptom was thermal was instrumental in weeding out sulfur. She was so very chilly that obviously sulfur was not a good choice, and it was not the indicated remedy, because chilliness is a hallmark of arsenic and heat is a hallmark of sulfur. So because this patient was so very chilly, it was such a red line symptom that we could not overlook that symptom, and we have to do away with sulfur. Also, I think so I've missed one aspect over here, or maybe not missed. As you can see, that chili aspect is also covered by calcarea carb. But why I have not taken this green into the green zone is because these more important symptoms higher up are missing in calcarea carb. Okay, coming to the next three symptoms. So arsenic and sepia, they remained in play, but moving on to the next three rows, the choice became more obvious as the former covers all three rubrics, that is between arsenic and sepia. So calcarea carb does acquire 2 points in the rubric fear of misfortune, but it is very low in our list. That is why it was not considered, and it, like calcarea carb, does not get any serious points for that. Sepia does not cover any other rubric and lost any remaining interest. So based on the green zone, you can see, and because the green zone is overlapping with each, so the brighter the green, the more that medicine is being given importance. It is getting favor. So for the final, the last three rubrics are covered by all medicines, and they were of least importance. Therefore, they were eliminated from the remedy selection. Okay, so this was the final basis of prescription based on the previous table. This is the follow-up chronology. So as you can see, in this case, I have discussed how we have to select the medicine, the process of selection of medicine. Now this is about the prescription part. So the first prescription was arsenic album 30, 3 doses weekly, followed by organum, that is Saclac, and Sabina 30, that was given only for her acute symptoms of menorrhagia, because like obviously I would want to keep it absolutely classical, but what happens often in practical cases is that because the patient is so very anxious, as soon as she encounters her cycles, she resorts to medicines like Trinaxa or anti-hemolytic and anti-hemorrhagic, and that is what we want to avoid. We at least want to keep the person purely on homeopathy, so that because this case is a part of research, so that uh, case does not get filtered out and excluded from the research study. So TVS and CA 125 was done. Initially, I have shown only the TVS reports. So this is the first follow-up. Right ovary is enlarged and the cyst came down to 42 cc, as you can see over here, where I'm pointing with the mouse, 42 cc. Even in the uterus, there were changes. We can take a preview later on in the overview. Okay. Now, this Sahara Hospital is a huge hospital in my city, in Lucknow. And this patient has got all her ultrasonography done over there. And you can see the radiologist herself has written in her report, final impression, that adenomyosis has reduced since prior study. Even the right enlarged ovarian cyst, the endometriotic cyst, has reduced since prior study. I hear most of the gynecologists' opinion is that endometriosis cannot be cured. It has to be surgically corrected. And this is what we hear every day. But this onologist herself mentioned that endometriotic cyst has reduced. So following up on 23rd August, these were the symptoms. The prescription remained more or less the same. Again on 3rd October and on 15th November, same prescription was repeated. Follow-up ultrasonography was done. So the right ovarian cyst, now it came down to 12 cc, 191 to 42 to 12 cc. There are other changes in uterus and in other structures also. Again, Dr. Rakhi Singh of Sahara Hospital, the sonologist, has mentioned that the ovarian cyst, hemorrhagic endometriotic cyst, has reduced since prior study. This is the image. In the previous one, the image was unavailable. I looked through the image, but the 42 cc cyst has not been shown in the film. That is why that was missing. In this third report, I've shown. And this is the right. Okay, so I skipped this. 28th December, after the previous TVS which I showed with 12 cc, same prescription was repeated. Menorrhagia was much better, and patient report mild hyperacidity. So this is the final report. Now these words by Dr. Rakhi Singh resolved on current study. So what basically she has meant to say is that the cyst, which measured 191 cc initially, has now resolved in the current study, only based on complete homeopathic treatment. I know a few people might argue with me that might debate with me that you should not have included Sabina in this, you should have kept it completely classical. I agree with them that that should have been the case, but because of the first of all the reasons mentioned, I earlier mentioned, it was prescribed so that the patient does not resort to any other stream of medicine any anti-hemorrhagic bit which will spoil the case in the research manner. Also, for another reason why we have to prescribe, like the important aspect is that homeopathy is able to cure a cyst which measures 191 cc. That is the takeaway from this case. A cyst of 9 centimeters, the size of an orange, can be resolved only based on simple homeopathic treatment and in a very short duration of time. I don't know whether you noticed or not what the duration of the study. On 17 May 2019, the patient showed this report and she was advised to stop treatment. So you can see from 7th May 2018 to 25th April 2019. So it is less than 1 year. Yes, it is almost a year, but it is almost, I would say, I think so, 10 or 12 days, less than 365 days. Within 1 year, this cyst was resolved. A cyst, which usually gynecologists and surgeon would say that it cannot be cured, you have to undergo surgery, there is no other option, and this is what homeopathy can achieve. So this is a very broad overview of all the changes that were seen in the report. I'm not, because of time constraint, I'm not mentioning all of those in words. It is mentioned over here for you to view. So the cyst 191 to 42 to 3.3 cc. I'm sorry, I think so. I have highlighted the wrong part. This, the 12 cc. This 3.3 cc is this other cyst, 5.4, that came down to 2.3. Then it enlarged slightly, which was 3.3 cc, and eventually it was resolved. So you can see, as I mentioned in the first report, there were 4 cysts in the left ovary, and all the 4 cysts were resolved in the subsequent, in the second TVS. So initially there was PID, and later on in all the 3 reports, PID was resolved in bilateral adnexa. In the second report, she developed hemosalpinx, bilateral hemosalpinx, that is due to endometriosis. But again, eventually that was resolved in the subsequent 2 reports. One thing that you can note over here is CA125, which was 60 initially, it came down to 40. Again, it rose to 69.43, and but then later on it came down to 42.29. I would have loved that the patient would have come to us, followed up the treatment so that we could have resolved even CA125. But because her major concern was now resolved, she was not concerned with CA125, so she did not appear after that. Now, these model cases are very short. I'm not going to discuss in detail. This is just to give you a preview into the skin diseases, what can be achieved with homeopathy, and just a short insight into the mental history, into the causative factors. So this patient had frightful dreams and was unable to sleep because of them. Again, see the importance of dreams. Dreams started after he passed from college and began looking for job. So a theme can be discerned that these may be anxious dreams. He was anxious for a good job, anxious regarding success. Yes, and associated symptoms were that he was afraid of dark and significantly of snakes. This is the repertorial totality. This was the final basis of prescription. This is a case of psoriasis. This is the initial condition of the patient, the initial photographs of abdomen, back, and leg, and now you can see the follow-ups of each. Calcarea carb 30 was prescribed. This is abdomen. You can note down the date also for the duration. So from February to May, almost 3 months. And this is the leg. Model case 6, this is a case of vitiligo. The patient is an unmarried female aged 20 years, greatly attached to her parents who suffered through major health issues. First, her mother underwent surgery in 2013. Then later in November, her father underwent CABG, that is coronary artery bypass grafting. She was highly anxious about their health. She had to take care of both of them together. She was insecure as she was also unmarried. She had also recently got a job but had troubles at work because she was distracted from work into the family responsibilities, taking care of her family. At one end, she needed to look after her parents, yet on the other hand, she had to secure a decent job, or for even for financial reasons, because when she is looking after her parents, if there is any major event, she needs the finances to take care of them. So she was drawn into all places, and she was swarmed in because all these responsibilities, and further grieved by all these responsibilities. Also, um, after her father's surgery, then she developed vitiligo. This is the repertorial analysis. All the rubrics which were taken up based on the life space have been mentioned over here. This was the final basis of prescription. Anxiety regarding parents, fear of misfortune, that something will go wrong, she will lose her parents. She was also very scared that she is going to lose her parents. And she used to say that she wakes up at night just to check up on them, whether they are okay or not. And she's not even able to sleep properly. If there's any slightest sound, she gets startled and wakes up thinking that maybe they are knocking or someone is someone needs help. So calcarea ka was prescribed, and these are the follow-up photographs. So my apologies, I have not been taking note of the time that I have taken up. I think so. It's almost 1 hour and 15 minutes. So I'll quickly wrap this up within 5 minutes. These are the few common root causes. These I have mentioned over here because if till now you have not been practicing classical homeopathy, if you have not been taking mental symptoms into consideration in your practice, if you are prescribing only based on Boger Bonninghausen approach, that is LSMC approach, which is the location, sensation, modality, and concomitant, that approach, if you're taking only that approach, then I would urge you and I would motivate you to also to include this in your case taking, to make this a part of your case taking, because all these chronic diseases, autoimmune diseases, these are going to be cured with this approach. I'm not saying that that approach, the Boger Bonninghausen approach, is not right. Even we use that, but that is on a case basis. This is not a cult. This is not a religion that you're supposed to follow only one practitioner, or only one Dr. Bonninghausen or Dr. Kent or Dr. Henneman. There is no following of that sort. You have to analyze. These are all different approaches, and that is the beauty of homeopathy, that there are so many approaches, there are so many tools present in a tool belt which we can use. So don't constrain yourself. Don't make Kentian and method and Bonninghausen method or any other method. Don't make it a religion. Keep it as a tool in your tool belt. Analyze the case. Each approach has some pros and cons. Evaluate those. Try to understand how you're supposed to evaluate those, and based on that, make a decision on the approach that you're going to take in any particular case. So these are few of the common root causes which I have given you for a startup as a Kickstarter, so that if you encounter any of these symptoms, you can give these importance in your case taking. So this is related to personal relations, and these are one of the very few, very common ones which we encounter every single day. Those are the ones that I've listed over here. One thing, uh, this is part of my conclusion. Coronary artery disease has always been believed to be caused by high cholesterol levels. This theory in the last 25 to 30 years has created so much fear into the people that people are quitting having food, they are quitting oil, and they are doing all kind of uh, crazy is the right word to use. Although I don't like that word, but that is the correct word to use in this place. That people do all sort of diet restriction and things in a crazy manner, just with the fear that of having coronary artery disease. But the latest research is now coming up with this, and believe me, the trend is changing. That and cardio surgeons are mentioning this, that even having a normal cholesterol level does not rule out the risk of heart disease. Another Dr. Fred Kumerov, he mentioned that we really can't depend on serum cholesterol levels as a causative factor of disease. Now, the present study, look at this on the right side, just read it out. A study suggests that psychoneuroimmunology, this is not a word that I have used, this is what I have quoted from a cardiologist. A study suggests that psychoneuroimmunology may also play a major role in the development of coronary artery disease. The evidence for the effects of acute and chronic psychological stress on the onset and progression of CAD is consistent and convincing. Study also suggests that correction of the psychological stressors. So you can see that this conforms with my topic, with my work, that studies also suggest that correction of the psychological stressors or various therapies which target the psychological sphere may be instrumental in curing numerous diseases. So again, that should ring a bell in your mind regarding my topic, role of mind in the treatment of physical diseases. This paper also highlights potential research areas and implications of early detection of cardiovascular risk in people under high psychological stress. So, not cholesterol levels, but high psychological stress. So, now that era that you have to look out for cholesterol levels to evaluate the risk of coronary disease is that era is now going away, and now it is transforming in in the future times. Now you will have to look out for high psychological stress factors, and then you would need to evaluate the risk of coronary diseases. So very short discussion. One might argue that how can you say that the mental symptoms which were present, those cause the diseases? So basically, it is the close time relation between the probable causative factor and the appearance of disease. That is why I have taken a certain criteria in my research, which is present in the inclusion criteria. Based on that time correlation, I have mentioned a symptom as being probable causative factor. As a very simple example, suppose you eat something today and within 24 hours you experience diarrhea. So without getting any gastric lavage done and getting any culture done of the gastric contents, you just able to, because of the time correlation, you are able to evaluate that it was something that you ate because of which you are experiencing this diarrhea or whatever distress you have experienced. So this close time relation is an important factor. Brain being the master organ may cause multiple diseases in various organs simultaneously. Simultaneously is a very huge keyword here. So brain being the master organ, you can see that the same person is suffering from hypothyroid disorder, and then maybe even fibroadenoma, maybe even rheumatoid arthritis, maybe even allergy. A single patient is going through a number of diseases. So despite disease which was not considered in totality, a positive response in those diseases can be elicited because we are treating from the root cause. So even the diseases that the patient did not mention to you, they will experience that those things also show improvement, and even they resolve just because we are treating from the root cause. Brain being the master organ again, multiple diseases in a patient respond to treatment. Treatment not only is halted but reversed pathophysiological processes. The treatment is not only halted, but the pathophysiological processes are reversed. There's something wrong with the grammar in this sentence. So I would like to point it out like that. Treatment is not only halted, but the pathophysiological processes are reversed. And that is how eventually the pathology is reversed. So final conclusion is homeopathy cures the person in disease and not the disease in person. This idiom is known to all homeopathic doctors. Disease does not enter the body from outside, rather, disease is endogenous. So, what Dr. Henneman had said that it enters through the mind, he did not mean that it comes from somewhere and it enters through your brain, through your mind. What he meant was that the disease is endogenous, the causes, the factors are within the body. And that is how the disease, like the disease process ensues, and ultimately the organ pathology develops. So the disease does not enter from the outside, it is endogenous, initiated from the mind. The current general approach is to surgically correct the pathology or to remove the organ. But the human body has built in natural processes to reverse pathologies. That is very evident to any homeopathic doctor. Instead of taking the surgical shortcut or the palliative shortcut, what we need to utilize Okay, I think so. Something has missed over here. The human body has natural processes to reverse the pathologies. So instead of taking the surgical shortcut, we need to utilize, we need to utilize these natural processes which occur in the body, which are present in the body. We just have to correct whatever pathophysiological process has been ensued, has the chain reaction has been started. We need to work at that root cause level, and once that is corrected, then the body itself reverses the pathology. And what I meant was that this is where homeopathy shines. So next time you're sitting in your chair in front of the patient, do look out for these causative factors. Thank you so much. And before I hand over the baton, uh, I would just like to thank Bhargav Phytolab for this great opportunity. And this is a great venture, a great initiative. And I hope that this goes on. I would really look forward to the next speaker who takes over after me in the next session. I would also like to I would like to acknowledge Dr. Jawahar Shah of Mind Technologies for his software HomePad Classic 8, which was used for repertorization in all the cases. I would especially like to thank all of my teachers who have made me capable to be sitting here in front of you today. I think so. Mr. Mahajan is present over here in front of me. I'm not able to see clearly, but I think so. He is there. Yeah, he was my organon professor in college, and I give my highest regards to him. He has been my guiding hand since always. So I'm very happy to see him over here. And I thank all the delegates and all the audience who are present over here. And I would also like to thank my father for being my guiding hand. Thank you so much.
Great, Dr. Gaurang. Great. It was a wonderful session. First of all, I should say this. And Dr. Girish is also here. Dr. Girish, thank you so much. I have heard a lot about you as well. And yes, on behalf of Bhargav Phytolab, I would like to thank Dr. Gaurang for being part of iSampark webinar series. And Dr. Gaurang, I can promise you that we will be back with the another session in on iSampark webinar very soon with another topic. So now there was one question in the chat. There are so many appreciation messages for you, Dr. Gaurang, in the chat window that I can see.
Thank you so much.
There is one question also. Dr. Alok Tiwari wants to know that how can we collect and evaluate mental symptoms in infants or child below 5 years, because they can't share their things. So how can we collect and evaluate mental symptoms in those cases?
Yes, that is a very great question, because that uh, uh, gives us that is a very challenging situation when you have to take the mental symptoms in children, and we face this challenge every single day. So I would say observation is the first thing, is the greatest tool that any homeopathic physician has. We are taught from the very first day that as soon as the patient enters your chamber, even he starts opening the door and you start observing him. So observation is a huge tool in any case, and when it comes to children, then it holds even more greater importance. And one thing I would also like to mention over here, that physical generals can be of great importance over here, because a lot of times you cannot get significant mental symptoms, but the physical generals, they really help you, assist you in selecting the simillimum. So anything, perspiration or thermal reaction, that the child throws away his blanket while sleeping, and perspiration that the child's hands or feet are always perspiring, or when the child wakes up, his pillow is wet, is from perspiring overnight. So these give you a clue about the intensity of the thermal reaction. And based on thirst, because children, they want to have chilled water, they want to have ice, or they always asking for water. Or then there is the counterpart, where the parents have to run around behind them, and they have to take care that the child is not drinking water, they will get hydrated, and they have to run around behind them, and the children try to avoid that. So this is how you get the intensity of physical generals, that can be of a great tool also. And observation, definitely, well, if you start observing the children, you will start to get a lot of symptoms. So what the way we can do this is that we can go through a few rubrics in any of the repertories, and we can see which are the symptoms which are more common in children, and whether they are observable or not. So in our mind or somewhere we can make a note of these, we can just study those, that these are the symptoms that we should look for when we are observing the child, and that is how we can form our totality.
All right, thank you, sir. There is another question that Gunjit want to ask. Yes, Gunjit, you can ask.
Yes, sir. Yes, ma'am. Thank you, sir. This was a very nice session indeed, sir. Sir, just my
Thanks.
question from at it, it was from the starting part of the PPT. You said that dreams comes due to dreams at night. People find it very delusional that if someone is m- want to murder someone, or he's falling from height. So, sir, if that dreams are a kind of role play of a conscious or of a subconscious mind, and how it can be controlled.
That is a very important question. I did not cover this in this presentation due to time constraints. So I'm glad that you asked this question, because
Thank you.
this is an aspect which is of very high, great importance, and this in itself is such a huge topic that it needs a separate presentation.
Yes.
So, but I'm going to cover the point which you asked. So you
Yes.
mentioned the subconscious and the conscious mind.
Yes.
Interestingly, dreams are a part of the unconscious mind,
Yeah.
and that is of the greatest importance.
Yes.
So when you look at the order of symptoms, the importance of symptoms in homeopathy, so most of the symptoms that we see are of the conscious mind.
Okay.
all the everything related to constitution and personality, they are conscious mind.
Okay.
Then comes the subconscious mind, which is where the fear and delusions, they are part of your subconscious mind. That means that you do not have total control over those. You can control those. If you have a fear of dark, just imagine you have a person has fear of dark, and a person wakes up at night, but there is no one around, and that person needs to go to the washroom. So somehow they will fight their fear for a single night, and they will say Hanuman Chalisa or whatever, and then they will go, and somehow they will manage. So you can just manage that. There is some voluntary aspect to fears and even delusions. But when it comes to dreams, you do not have any control. You're not even aware. You do not have the consciousness whether you are dreaming or whether you are in a real state.
Okay.
So impact of dream even stays with you for a few minutes or even for a few hours afterwards, after you wake up. Sometimes, like even with your personal experience, you will see sometimes someday you have a bad dream, and for maybe 15 minutes or half an hour, you're not feeling all right. You are depressed and you feel very down and very low, when actually your life is going very well. And maybe even the previous day or the same day, you have something very exciting coming up. But just because of that dream, for a few hours, you're not in a very in a happy mode, or you are in a frightened mode for transiently. So what I want to mention is that uh, as I was mentioning the importance of symptoms, the unconscious mind comes at the highest.
Okay.
The more involuntary it is, the more important it will be. So the dreams are the most unconscious. That is why they come at the topmost. The second is delusions, because they are partially they are subconscious. But again, you do not have as much control over delusion as much as of fear. You can control your fear, but you cannot control your delusions. So delusion is at the second order. Fear is more of the conscious part, and it is very partially subconscious. That is why it comes at the third stage. And then what follows is all the other symptoms, with one exception, that is causation, which even supersedes dreams.
Acha.
So if you want to go at the absolute root, that is the cause. That is of the most importance. If only the cause is there, even 40, like only the cause can veto, can rule out 40 other symptoms.
Okay.
And if a cause is not there, then this is the order of symptoms. Or if you want to give other symptoms importance, then dream, delusion, fear, and followed by other mental generals.
And the same is the case with intuitions.
I'm sorry, intuitions, you said?
Yes, sir. Intuitions.
Intuitions.
If I'm sitting here and I feel like someone is standing back, but I have not noticed that person. So that kind of intuition, अचानक से मुझे आभास हुआ कि someone is there behind me now.
That is a delusion, basically.
Okay.
That is a delusion. So there is a very fine line between illusion, delusion, and hallucination.
Okay.
So what you mentioned, in our English language, in grammar, we can give it the name intuition or delusion. But from the repertorial aspect, when you rubricate the symptom, as it is said, so in that sense, delusion is the correct terminology.
Correct.
So delusion is the rubric that you look for.
Okay, sir. Oh, thank you, sir. Thank you.
We have one question in the chat window also, that for children, how can we decide the potency, especially in the cases of depression?
So potency is a very touchy subject because posology has no evidence, no scientific grounds. So this is one topic, one subject which always creates a lot of debate. And basically because there is no frame of reference, there is no proof behind that. So as I've understood regarding posology is that it is up to your understanding, it is up to your comfort zone. The need of the hour is to prove that homeopathy works, the kind of pathologies that homeopathy can resolve. As you said, with depression, now people say, I'll just clear a misconception over here, since this topic has come up. People say that 30 potency is very low and you should give high potency 1010. But if you look at it, potency is a frame of reference. If you're comparing 1030, 30 is a very low potency, 1000 is very high. But what if I say that you compare 1x with 30, which is the higher potency? So how do you say 1x is lower or 30 is lower? 30 is very high potency. Imagine, I mean, because you are in the pharmacy business, you you will have even much more and farther greater knowledge regarding pharmacology than me. So just imagine the number of triturations and the whole lot of process that goes on in developing a simple 30 potency.
Correct,
So
correct.
people who say that 30 potency is very low, sometimes just for the, I'm just making a joke, I feel like that I should ask them to make one single 30 potency by hand, anything,
True.
well,
Yes,
belladonna or anything, just give them tincture and ask them to make 30 potency out of it. So after a week, then they will know that how high 30 potency is.
it's very true, sir.
So
Very
so
true.
it is a frame of reference. It is up to your comfort zone. Whoever has asked that question. If you're comfortable with 200 or 1m, that is fine. If you're comfortable with the decimal potencies, that is great also. If you're comfortable with LM potencies, great enough. My experience, not when in practice, I'm saying my experience in having attended so many lectures and seminars of our stalwarts and of my predecessors. I have seen that every potency works. Everybody has their own experience with a frame of potency. Every potency is working. It is just a tool in your tool belt, whether you use a hammer to hammer something or whether you use a pliers or anything. So that is just an analogy. You can use anything, but and everything works. So the need of the hour is just to prove that it works.
Right. Well said, sir. All right. In case of any other question, I'll request doctors to share it in the chat window. Okay, there is a question by Dr. Deepmala.
Yeah.
I want to ask a question on, okay, so she wants your number. If okay, can I share it with Dr. Deepmala, sir, your number
Yeah,
or
absolutely
your
fine.
email
Sure.
ID, whatever you prefer?
Both are okay, no
Acha.
problem.
So, Dr. Deepmala, I have your number. I'll connect with you directly for this. Thank you so much, Dr. Gaurang, and thank you everyone in the audience who joined us today for this webinar. And very soon we will be back with another session on iSampark. And Gunjit has just shared a link wherein you can share the feedback of today's webinar, and also you will get a digital certificate for participation, which you can download, which will directly come to your email ID. So thank you so much. And in case of any questions related to the topic or related to homeopathy or related to Bhargav Phytolab, we are still here. We can answer that. Meanwhile, Dr. Gaurang Gupta, thank you so much for taking out your time and taking this session. It was indeed very interesting and very knowledgeable.
Yeah, thank you so much. I would love to hear the feedback about this topic,
Sure, I'll
because
definitely.
Yes, sure, sir.
Yes.
because this is one topic, it either bores people or it is highly interesting.
But it is very
So
interesting. What I feel, I
No,
have,
makes interest.
listened to each and every thing, whatever you said in the last 1.5 hours, but it was really very interesting.
Inside
thank you so much.
the part of brain, the dreams and delusion part, I like much more because this is a day-to-day activity which I see. So much getting
Yes.
into more deep into how the brain works is more interesting.
Yes, that is very
All
interesting.
right. Yes, correct. So thank you so much, everyone. Thank you. I cannot see any questions. I'll share your number with few doctors who wants to connect, sir. And that's it. Thank you. We
Okay,
are
thank you
ending.
so much. I thank the whole of the Bhargav Phyto Lab team for all the effort, and I can see all the hard work that has gone into this. So congrats all of you.
Thank you, sir.
Thank
Way
you.
to go.
Thank you, sir.
Thank you, sir.
Okay, shall I disconnect?
Yeah.
Yes, sir, you can discuss.
Yes, yes.
Okay, thank you so much.